Hello, my name is Claire Mitchell. I am a medical oncology consultant at the Christie and I'm clinical lead for the Acute Oncology Pathway Board. Acute Oncology oversees the pathways of patients that require emergency care at their point of cancer pathway. This may be a point of diagnosis, while receiving treatment, or towards the end of life. Input may be required due to complications related to either their patient's cancer, their treatment, or due to other health-related issues. Over the last 12 months, the Acute Oncology Board has continued to progress with the work programme initiated in January 2020. Despite the current challenging environment, progress has been continued to be made in achieving our goals. The COVID pandemic has emphasised the need for acute oncology teams in the provision of urgent care for our cancer patients. We've seen patients present later in their cancer journey with increased disease burden and more complex oncological needs. It has also emphasised the need to develop alternate routes to admission for management of cancer-related complications and for diagnosis. Moving forward, the Acute Oncology Board will continue to aim to develop services which meet the needs of our patients, working with associated specialities and develop collaborations with our acute oncology colleagues around the UK. The Macmillan Cancer Support and GM Cancer Acute Oncology 2-year programme, which has run from January 2020 to January 2022, has set itself high ambitions within the first year, and even through the challenging COVID environment, we've already achieved much. We've formalised documents such as consultant roles and responsibilities, service recommendations with modelling and COVID management planning that will enable our acute oncology teams within their trust to have supporting documentation to push forward in getting acute oncology recognised as an essential service in our interlinking networks. We've run the Educational Nurses Forum to upskill our nursing teams and have had teaching sessions on topics such as paraneoplastic syndrome, renal cell cancer, immunotherapy, prostate cancer, and to align with this virtual Cancer Awareness Week, brain metastatic disease. We are passionate that our patients and carer voice remains the highest and most heard voice within our working groups, and strive for quarterly engagement meetings and email correspondence to ensure that there is continued key worker collaboration. We're continuing to pursue innovative and explorative ways of working through associate physicians, apprenticeships, and nursing associate roles. We're also at the forefront of the MUO and CUP reform pathways, initiating peer conversation around patient impact statement, standardisation of referral performers, centralising services. We need the acute oncology voice and services to be further heard and considered and recognised throughout the network and nationally. Please do get involved if you want to know more.